Assalamu alaikum. Nasim Assar here, roll number 1650161. The drug I am going to present is Ergocalciferol, aka vitamin D2. Introduction. Vitamin D2, Ergocalciferol, is a form of vitamin D that helps the body use calcium and phosphorus to make strong bones and teeth. It is fat soluble and is found in plants and yeast. Rational use. Vitamin D is also used with other medication to treat low levels of calcium or phosphate caused by certain disorders such as hypoparathyroidism, pseudohypoparathyroidism, and familial hypophosphatemia. It may be used in kidney disease to keep calcium levels normal and allow normal bone growth. Vitamin D drops or other supplements are given to breastfed infants because breast milk usually has low level of vitamin D. Now come towards contraindications. It is contraindicated in patients with hypercalcemia, malabsorption syndrome, abnormal sensitivity to the toxic effect of vitamin D, and hypervitaminosis D. Side effects. Allergic reactions like skin rash, itching or hives, swelling of the face, lips or tongue, bone pain, increased thirst, increased urination especially at night, aka nocturia, irregular heartbeat, high blood pressure, seizures, unexpected weight loss, unusually weak or tired. Now, dosage and administration. For hypoparathyroidism, usual adult and pediatric dose include 50,000 to 200,000 international units orally daily, concomitantly with calcium lactate 4 grams 6 times per day. For rickets, usual adult and pediatric dose includes 12,000 to 500,000 international units orally daily. For vitamin or mineral supplementation, usual geriatric dose is for up to 70 years of patient 15 microgram daily and over 70 years of age patient 20 microgram orally daily. Usual pediatric dose for 0 to 12 months of child 10 microgram orally daily and for 1 year and older 15 microgram orally daily. Now come towards dosage adjustment. For hepatic and renally impaired patient, there is no dosage adjustment provided in the manufacturer's labeling. Drug toxicity. Hypervitaminosis D is the most toxic effect of vitamin D. Hypercalcemia occurs as a result of increased calcium absorption from the intestine and increased bone mobilization. Drug-drug interactions include prednisone. Taking steroid medication can reduce calcium absorption and impairs your drug's effectiveness. Stimulant laxatives. Long-term use of high doses of stimulant laxatives reduces vitamin D and calcium absorption. Alternative brands of ergocalciferols include Resdol, 50,000 international unit oral capsule. If given in quantity of 100, then its price would be $313. And the other brand is calciferol, 50,000 international unit oral capsule. If its quantity is 100, then its price would be $50. Irrational use. Irrational use of vitamin D. Here we have 50,000 international unit required prescription and 5,000 international unit available over the counter. Irrational use result in hypervitaminosis D, which is characterized by number 1, hypercalcemia with anorexia, nausea, weakness, weight loss, weight gases, and constipation, etc. Impairment of renal function, calcification of the soft tissues, increased mineralization, shouldn't take more than 100 microgram, that is 4,000 international unit. Vitamin D sold with droppers that could allow parents to accidentally give harmful amount of vitamin D to their infants. Now, case study. A 34-year-old Japanese woman presented with the 2-year history of generalized bone pain, muscle weakness, and gut disturbance. The patient had been following a restricted diet, that is without fish and dairy products, and avoiding ultraviolet exposure for 8 years to manage her worsening atopic dermatitis. Physical examination revealed generalized bone tenderness and bilateral symmetrical proximal muscle weakness. The examination also indicated the temperature, that is 36.3 degrees centigrade. Blood pressure 110 upon 72 millimeter of mercury, pulse rate 88 bpm, respiration rate 12 breaths per minute. Laboratory examination revealed high serum alkaline phosphate, that is 1345 units per liter. Bone type is 71.2%. High intake parathyroid hormone is 500 pg per ml, and low serum calcium level, that is 7.6 milligram per deciliter. Low phosphorus, that is 2.2 milligram per deciliter, and low 25 hydroxy vitamin D, that is lesser than 5 mg per ml RIA. Liver, pancreas, and renal functions were normal. The bone mineral density T score as measured by X-ray absorptiometry was 5.7 at the lumbar spine and 5.8 at the femoral neck, indicating low BMD for her chronological age. Moreover, increased bone turnover marker for bone resorption, that is deoxypyridinoline 31.2 nmol per mmol, SIA, and formation osteocalcin 7.8 ng per ml. Plain film radiography revealed a pseudofracture in the left inferior pubic rami. Now come towards the case solving part. Here, first thing we have is subjective, that is chief complaint. 2-year history of a slowly progressive generalized bone pain, muscle weakness, and gait disturbance. Aggravating factor pain in the lower back, pelvis, and legs, aggravated by loading. Gender is female, and origin of that female is Japanese. Age 34 years old. Medical history atopic dermatitis since 8 years. She has been following restricted diet, that is the exclusion of fish and dairy products in her daily diet, avoiding UV exposure for 8 years for the management of her atopic dermatitis. Current medication include topical steroids for atopic dermatitis. Now come towards objective physical examination. Physical examination revealed her body temperature at 36.3, that is approx normal. BP 110 upon 72 millimeter of Hg, pulse rate 88 bpm, again regular one, and respiration rate 12 breaths per minute. Lab test. Lab test revealed high serum alkaline phosphatase, that is 1345 units per liter, high intake parathyroid hormone 511 pg per ml, and low serum calcium level, that is 7.6 milligram per deciliter, low phosphorus level, that is 2.2 milligram per deciliter, low 25 hydroxy vitamin D, that is lesser than 9 ng per ml. Liver, pancreas, and renal function were normal. Bone mineral density T score is equal to 5.7 at lumbar spine and 5.8 at femoral spine. Now come towards diagnostic data. Plain film radiography. Plain film radiography revealed a pseudofracture in her left inferior pubic rami. Symptoms: bone pain, muscle weakness, and gait disturbance. Signs: low levels of vitamin D and hypophosphatemia due to restricted diet and UV exposure avoidance. Now come towards assessment. Plain film radiography reveals pseudofracture in her left inferior pubic rami. Since she is diagnosed with osteomalacia due to vitamin D deficiency, which is attributed to the restriction of vitamin D intake and sun exposure avoidance for the management of atopic dermatitis. Plan. So the treatment plan should be initiated with the oral administration of ergocalciferol, brand name Dosage, 0.75 microgram per day, and calcium 1 gram per day. Consult your physician at the monthly follow-up to check the recurrence condition as well as for the pain and gait disturbance. Now, here that brings us to the end. Thank you.